Welcome to the latest version of the Scale Community Analyzing Healthcare podcast. I'm joined today by Priya Basu, the founding executive head of the Pandemic Fund. It's a real honor to have you here, Priya. Thank you for joining.
Thank you. Great to be here.
One little anecdote that I heard in the past was that really resonated with me. I was interviewing a US healthcare leader who said, "You'll know that we're ready for the next pandemic because we'll be busy preparing for the next pandemic, talking about it, knowledge sharing ahead of it before the even pandemic ever shows up." But in contrast, if you're not hearing anything, if there's silence out there, then by definition, we're not going to be ready. And so I still maintain that there's not enough discourse, there's not enough focus from on the ground operators and regulators about the next pandemic, because we're, I think, still busy licking our wounds from the last pandemic. So it's almost like a case of denial.
When I travel to Africa, when I travel to East Asia, to South Asia, I do notice that the COVID pandemic is still very much on people's minds, on the minds of their policymakers as well as the general public. I mean, the developing world, the global South, really suffered a lot from the pandemic. You go to India, people haven't forgotten about the Delta variant and the havoc that it created. So this we see as an opportunity. In some parts of the world, perhaps people have moved on to other pressing global priorities and issues and needs, but the role of the Pandemic Fund really is to
keep the focus.
To keep the focus and to remind the world that we cannot afford to be unprepared. And also just the simple math of it, the cost of investing in these kinds of critical areas shouldn't really be seen as costs. They shouldn't be seen as expenses, but also that the investments needed are a tiny fraction of the cost of being unprepared. And COVID showed us the trillions of dollars of world GDP that were lost because we were ill prepared for we allowed a tiny virus to create havoc. And not to mention, of course, the lives lost and the ramifications. So, the role of the Pandemic Fund is, of course, to keep that focus on the investments that are needed. And at the same time, also remind the world that those investments needed are at a small fraction of the cost of not being prepared.
Really important points there. So I really appreciate you highlighting that. The good and the bad, whether it's during COVID or since COVID, the work that you've been doing at the Pandemic Fund. I'm interested in your anecdotal examples of either great programs, great countries, great governments, great projects that you can turn to in a room and quickly point to and say, "Hey guys, for your project, for your country, this is an example that we want to try to emulate of how to build the right preparedness." And similarly, you don't have to name examples that haven't worked quite well, but just frame what are some of the most challenging projects that you've had to interact with, and what are some of the biggest obstacles that you faced that prevent us from moving everyone up to this optimal standard that I imagine some groups have been able to reach. What are your thoughts?
Sure. So, I mean, these are still early days. We aren't even 3 years old yet. We will soon be 3 years old. But, I'm proud to share that we made a lot of progress, and there are some very promising projects, ones that jump to mind. And these are some of the earlier projects that were rolled out, so they've had a bit more time to show results. So, in India, for example, we have a One Health project that stands out for many reasons. One, that it has catalyzed an enormous amount of resources. A $24 million grant catalyzed $341 million of additional financing 14 times. So we were able to reach a leverage ratio of 1:14 through that project. And what makes it stand out is that it is very squarely focused on One Health. It is really galvanizing collaboration across ministries of health, finance, agriculture, animal husbandry, taking this sort of multi-sectoral approach to building a resilient health system through training a One Health workforce, veterinarians, livestock farmers, animal health workers. India has the largest livestock population in the world, so it's a very important
I'm not surprised, having spent time in India, that the livestock is everywhere.
Right, and the risk of zoonotic diseases is very high, but this is the first time that there's been real action in terms of focusing on this One Health, and it's part of the government's One Health national mission, but it's really helping to train the workforce. It's helping to build surveillance capacities at district levels and laboratories, strengthening veterinary labs and connecting them with human labs, and ramping up testing capacity, point of care testing capacity. One point I do want to make here is that the pandemic fund takes a disease agnostic approach, because we don't know what the next pathogen that has the risk of becoming a pandemic is, right? So when we build that capacity for testing at the primary healthcare level, it is providing equipment. It doesn't necessarily have to be very fancy equipment, but PCR testing, X-ray machines, those that can test for all kinds of different pathogens. So that India project, it's a One Health project, I think it's progressing very well. Another great one we have is in Rwanda, and this one actually, again, it did achieve a high leverage ratio of 1:6. And particularly, I want to emphasize that the government has put in a lot of its own resources, brought in sizable what we call co-investments, and this is again focusing on wastewater surveillance plants and ways to do a quick surveillance of emerging pathogens. Again, it's focused on strengthening laboratories. It is training the workforce, and it was put to test last year when there was an Mpox outbreak in Africa, and Rwanda was one of the several countries in Africa that was affected by Mpox. And so the project really helped with the quick detection and containment of Mpox. But beyond that, soon after Mpox or during Mpox, Rwanda was also hit by another outbreak, the Marburg virus disease, which has a very high fatality rate, I believe about an 80% fatality rate. But Rwanda was able to quickly detect and contain Marburg as well, thanks to the investments that had been made. And I'm talking about this, but the health minister of Rwanda, Dr. Zanzimana, who actually is the co-chair of the Pandemic Funds Board, speaks about this very eloquently and compellingly. So we're very proud of that project. Then we have, as I was mentioning earlier, we have cross-country and regional projects. One that was rolled out, I believe it was the first of the Pandemic Fund projects to be rolled out. It was in the Caribbean. The Caribbean Public Health Agency is the executing agency for that project, and it brings together 20 plus member states of the Caribbean, and it's managed to make a lot of progress in developing sort of a regional cross-country surveillance network using technology and AI and so on. And it was put to test last year when the Caribbean hosted the Cricket World Cup. And so apparently, it's a project that's really building the region's resilience to emerging outbreaks. So those are just some of the projects, but there are lots of them. There's 47 of them, and some are, some have had
It's your
more time.
portfolio of investments.
Right. I mean, another one maybe I should mention is Ethiopia. If you land at Addis Airport, you will see a pandemic fund sign right there. Ethiopia is taking this agenda very seriously, and our project has really galvanized multi-sectoral collaboration across all of government and brought in communities as well. Again, it's focusing on this One Health multi-sectoral approach, public-private partnerships, using technology and AI tools to help with data collection, data sharing, data reporting. So yes, please do visit our website. We have a lot of good examples. But of course, turning to the other part of your question, it's always not, these kinds of investments are sometimes, they take time to begin to generate, impact. Some of the countries that we're working in are countries that are fragile, conflict affected. 30% of our portfolio actually is in fragile and conflict affected states. So, there, it takes a bit more time and effort to.
You've got your work cut out for you, for sure.
Generate results.